Hello, good morning, everyone. Welcome and thank you so much for joining us for today's webinar on the impact of COVID-19 vaccination on fertility, presented by Rupani Foundation USA. I am your host, Dilshad Meghani, Community Outreach Coordinator with Ivf USA. The Rupani Foundation is offering this webinar addressing topics around the COVID-19 vaccination. This session will offer a real-world perspective on different issues and the impact of the COVID vaccine on fertility. Today, we are having a brief conversation with Dr. Toral Parikh about the following three topics. Number one is COVID vaccination impacts before, during, and after pregnancy. And number two is fertility using in vitro fertilization options. And number third is fertility options other than in vitro fertilization. As we anticipate the end of this pandemic and we plan to get our routine back to the normal, each of us has two choices for our personal health outcomes. The first is we get the vaccine and curtail the severe effect the virus has on our health. The second is we do not get the vaccine and risk our own life as well as others in the process. People who decided to get the vaccine often experience several days of fever, muscle ache, chills, and other cold-like symptoms. However, it's important to mention the vaccine does not cause infertility. Before we get started, I would like to go over today's webinar agenda with you all. First of all, we will be going over webinar etiquettes to assist you in participating in today's event, followed with an introduction of our guest speaker and panelist. After the introduction, we will give our guest speaker, Dr. Toral, the opportunity to share her presentation about the impact of COVID-19 vaccination on fertility. We will also ask you all to actively participate by answering some poll questions throughout today's presentation. At the conclusion of our speaker presentation, there will be time for question and answer from the attendees. This is where you will be able to ask the questions and we will address them by the end of this presentation. Let's go to the webinar etiquettes to follow. Attendees will be muted to ensure clarity for guest speaker and panelist. We ask that you please use the chat function at the bottom of your screen for any technical issue you may be experiencing. If you have a question, simply use the Q&A box in the control panel on your screen. You may send your questions at any time during the presentation. We will collect these and address them at the end of this webinar. Please be sure to ask to all panelists and attendees. We request you to take a minute to complete a brief survey at the end of this webinar. Excuse me. I am very excited to introduce today's panelist. Thank you all for joining us today. Let us start with the chairman of Rupani Foundation. Mr. Nasruddin Rupani is a US-based Pakistani philanthropist and highly successful entrepreneur and has a deep compassion for community services. Mr. Rupani seeks to promote the welfare of others to improve the quality of life for individuals around the globe. Thank you, Mr. Chairman, for believing in power of community services. Next, we have Mr. Amit Mathwani, CEO of Rupani Foundation USA. Mr. Mathwani is dedicated to his work and continues to be a beacon of leadership for the organization. Mr. Mathwani, please.
Good morning here in the US and good evening if you may be on the other side of the world. And welcome to this webinar on behalf of our board and our board chair and founder, Nasruddin Rupani. We thank you for your attendance here at this webinar and for supporting us in our goal to unlock access to so many resources that are available to ensure the positive early childhood development for all families. what Rupani Foundation strives to do is to make sure that the most up-to-date scientific information and best practices are always available for anybody, for any family, and for any caregiver to ensure that the youngest children among us can have the best possible development outcomes. For that reason, I also would like to uniquely thank Dr. Parikh for being here with us today. It is a huge privilege to be able to have this level of expertise in the field, to be able to share that expertise with communities all around the world and here in the US. We are deeply indebted to you, and we thank you for your philanthropy, Dr. Parikh. Thank you all, and enjoy the webinar.
Thank you, Mr. Mathwani. Now, I would like to introduce today's guest speaker, Dr. Toral Parikh. Thank you for joining Rupani Foundation USA and welcome. Let me introduce Dr. Toral Parikh a little bit further. Dr. Toral Parikh is a board-certified OBGYN and board-eligible reproductive endocrinology and infertility specialist. She completed her REI training at the world-renowned National Institute of Health and Walter Reed National Military Medical Center, alongside training from specialists at Shady Grove Fertility Center. She accomplished her baccalaureate education at Emory University, graduating magna cum laude, obtained her MD at the University of Miami Miller School of Medicine, and masters her residency training in OBGYN at MedStar Georgetown University Hospital in Washington, D.C. Dr. Parikh is a Howard Hughes Medical Institute scholar whose research interests have been notable throughout her medical career. She has published relevant cutting-edge studies within peer-reviewed journals important to advancing the field of women's reproductive health. She has presented her work at several national and international conferences and received the Society of Reproductive Investigation Award for her most recent her recent work on the medical management of uterine fibroids. She is Fellow of American College of Obstetricians and Gynecologists and an active member of the American Society for Reproductive Medicine and Society for Reproductive Investigators. Dr. Parikh is excited to welcome patients as part of her professional life and caring team at Advantage Women's Care. Her clinical expertise also includes assisted reproductive technologies such as intrauterine insemination, in vitro fertilization, and fertility preservation. Her expertise with infertility has provided her with the ability to consult with compassion and offer informed diagnosis and equitable guidance to individual and couple alike. Before I turn it over to the speaker, I would like for you all to answer a quick poll question that's going to pop on your screen in just a second. Okay, so you can see the question on your screen. So it's saying that can coronavirus be transmitted to the fetus during pregnancy? You have three options: yes, no, and don't know. So you will go, so I'll give you a moment to click on your responses. Okay, I can see the responses are coming from my attendees. Yes. Okay, thank you for participating. Okay, now let me share the result with you. You can see the result on your screen. Okay, according to this one, we have 29% of the participants are agreed with the yes answer and 43 are saying no. And we have like 29% are agreed with they don't know either. Okay, thank you so much for participating in our first poll question. So now I'm going to invite Dr. Toral. So it's your turn, Dr. Toral, now.
Okay, thank you very much. I'd like to thank Dilshad and Dr. Mathwani for allowing me this opportunity to talk with you all today. My presentation is largely to educate the community regarding COVID-19 virus, as well as vaccination and its implications on pregnancy, as well as the reproductive women who are looking to try to conceive, who may be infertile and currently going through infertility treatments. So just as an introduction, the coronavirus, also known as the SARS-CoV-2 or COVID-19, has obviously caused a lot of implications on our daily lives as well as our medical care, both here in the United States as well as worldwide. While both men and women are affected by COVID-19, the actual use of both the COVID-19 vaccination as well as preventative care, management, aspects such as PPE, may affect and impact both pregnant women and reproductive women who are undergoing infertility treatment. With over 6 million pregnancies in the year, in the United States, pregnant women constitute a significant portion of the population and even greater worldwide. So what do we know so far? We know that COVID-19 is an evolving pandemic, that it differentially does impact women versus men. And the CDC and WHO have been able to recently look at studies looking at men and women, but have not officially published any data that show the effect and impact of COVID-19 by gender. According to the CDC, there is insufficient data at this time to know whether or not women are more at risk than men for adverse health outcomes, but small studies done in China as well as other nations worldwide have shown that men are at slightly increased risk for COVID-19 and its long-term impacts than women at this time. The American College of Obstetrics and Gynecology has issued a statement that say that pregnant women are actually at higher risk to severe illness, morbidity, and mortality than non-pregnant women or the general population. And that's likely due to the hormonal changes that occur with pregnancy, increased blood flow, increased oxygenation, and that likely makes women who are pregnant at greater risk of both acquiring the virus as well as having complications once the virus is acquired. So can the coronavirus be transmitted during pregnancy or breastfeeding? Currently, we don't know. That's the short of it. There have not been any cases of vertical transmission or transmission from mom to baby of the coronavirus that have been documented to date. There have been a few infantile cases of COVID-19 infection that have been noted. However, it is unknown whether it was the mother who transmitted it to the newborn or if it was the newborn acquiring it from the outside world. In order to know this, essentially amniocentesis would be needed to be done in pregnancy, and that has not been done to date to see whether or not the actual child has been infected during pregnancy. A few cases that were documented are still unclear in terms of the severity of the COVID-19 if the virus was acquired through vertical transmission. The CDC has issued precautionary guidance for women who are suspected of having the COVID-19 virus, both during pregnancy as well as with breastfeeding. And the concerns there are largely due to the complications that can occur from the virus on the young newborn or the mother who has recently delivered. The Royal College of Obstetricians and Gynecologists also suggests that there's no data linking COVID-19 with increased risk of pregnancy loss. That's really important for those women who are looking to conceive and get pregnant. A lot of times early on with the COVID-19 virus infection, doctors were recommending that women hold off on conception care Now that the virus has been around for over a year, the studies have shown that because these women are not at increased risk of having pregnancy loss, it's better that they undergo care in a very strict manner of using PPE and with hopeful vaccination prior to undergoing fertility treatment. So let's talk a little bit about access. It's really important that both the pregnant person as well as the non-pregnant person in this situation understand that there are multiple ways of still being able to obtain care without actually have to physically go in to get care at a physician's office. Virtual appointments have now taken off both here in the United States as well as worldwide. And so prenatal care can be performed both virtually and home monitoring using both blood pressure cuffs and Dopplers at home that patients can acquire, allow the patient to limit the amount of exposure they have to the outside world. Online consultations as well as postpartum visits outside the hospital are also ways that the pregnant and recently delivered patient can receive care without also having to, again, expose themselves to the outside world and the COVID-19 virus. So talking specifically regarding patients who are trying to get pregnant, it is really important that guidelines be followed when considering the vaccination. Currently, it is recommended that patients receive the vaccination prior to conceiving, if possible. And when it comes to pregnant patients, currently the CDC does recommend that all women get vaccinated regardless of being pregnant. Current vaccines that are on the market include Pfizer, Moderna, and the Johnson & Johnson vaccination, which is currently on hold, secondary to side effects that have been recently noted. These vaccinations are currently being administered here in the United States as well as worldwide. Recommendations from ACOG, which is the governing body for obstetricians and gynecologists currently in the United States, recommends that the COVID-19 vaccine not be withheld from any individual who's pregnant or non-pregnant. COVID-19 vaccines should be offered to lactating women as well. And this is a way for the antibodies to be transmitted to the unborn child or the recently born newborn. Vaccines currently available have not been tested on pregnant women, and currently trials are underway to look at the benefits and risks of these vaccinations in these women. Pregnancy testing should not have to be done prior to receiving the vaccination, and so this should not be a way to limit any population or group of individuals from receiving the vaccination. There have been claims that the vaccine affects infertile women and may potentially cause early miscarriages. The governing bodies here, both ACOG and ASRM, have been very strong in their recommendations and their guidelines that this is not true, that there is not an increased risk of early miscarriage. Although there have been cases of individuals miscarrying after receiving the vaccination, there's no evidence that the two are actually linked. At this time, I'll take any questions regarding COVID vaccine and pregnancy and infertility.
The questions are coming, and let's put for the Q&A portion at the end of this presentation. So we will ask all the questions over there all together. So then you can address the question. Yeah.
Okay, so I'll move on. The next portion of my talk is in regards to the general education of the population about infertility and non-IVF options. That's non-in vitro fertility options.
Yeah, can you hear me? So we're gonna talk about this one after one quick pause. So then we're gonna go ahead.
Sure.
Yeah. Okay, thank you, Dr. Parikh, for your valuable presentation. Even the knowledge about the coronavirus and the impact on pregnancy, during and after pregnancy. Thank you so much for sharing with us. Again, if you have any questions, you may ask them at any point during the presentation in the Q&A box, and they will be addressed at the end of the in the end of this portion. And in the Q&A portion, we will ask the questions and we will address them. So after learning so much about the COVID vaccination impacts before, during, and after pregnancy, this transition perfectly into our second poll question. So you can see the second poll question on your screen. Okay, so it's talking about what are the main causes of infertility. So we have like four options. Maybe endometriosis and low sperm count or problem with ovulation. So I'm gonna give you a moment to click on your responses. Okay, superb. So I can see the responses are coming from the attendees. Thank you for participating. Okay, let me share the result with you. You can see the result on your screen. So we have 11% are saying that endometriosis, and we have 33% are saying their problem with ovulation, and we have 56% are saying that all of the above are the correct answer. Thank you so much for participating in our second poll question. Okay, now to discuss fertility using in vitro fertilization options, I will once again let the speaker to take over. Dr. Toral, please.
So talking a little bit about infertility, it does have its definition in women who are less than 35 years of age. This is a period of greater than 1 year of unprotected intercourse and failure to conceive. In individuals who are greater than 35 years old, we usually say 6 months of unprotected intercourse and failure to conceive is a diagnosis of infertility. Infertility can be caused by multiple things. There's both male infertility as well as female infertility. Female infertility is largely secondary to anovulation or the inability to ovulate eggs, as well as uterine components or tubal components that may lead to infertility. In male infertility, this could be due to low sperm counts. It could be due to sperm that don't move well, or an actual inability for the sperm and egg to fertilize normally. Talking about normal physiology, in a woman's cycle every month, the average woman will ovulate 1 egg from her ovary. This will occur from either the right or left ovary. They don't go back and forth. It could be the same ovary every time or the alternate ovary that does ovulate. The egg will then travel down the fallopian tube where it will meet the sperm. Once the egg and sperm combine, the embryo then grows in the tube and then implants within the uterus around day 5 of life. Ovulation induction is a term that infertility specialists use as a way to increase the number of eggs that are being formed in a woman's ovary. Oral medications or injectable medications can be given to help the woman create more than 1 egg. This helps to increase the chances of conceiving, as multiple eggs are better than just 1 egg in terms of potentially fertilization. Oral medications include clomiphene citrate or Clomid, or the other medication is letrozole, also known as Femara. These medications are taken from day 3 to day 7 of a woman's menstrual cycle to help increase the number of eggs that are forming in the woman's ovary. Injectable medications such as Gonal F or Menopur, which are the names of the medications here in the United States, are given to help even further stimulate the ovaries and create even more eggs. These injectable medications can be used outside of IVF to help increase the egg numbers in individuals who may not have as many eggs, but are typically used in vitro fertilization cycles. Ovulation predictor kits are kits that are available for women to use to figure out where in their menstrual cycles they're most likely to ovulate an egg. These kits can be purchased from online or at a local drugstore, where the individual, typically starting on day 10 of their menstrual cycle, will go ahead and urinate on the stick, and the stick will then turn positive when the person is close to ovulating. Typically, for infertility specialists, once medications are taken on cycle day 12 or 13 of the patient's cycle, they will bring them in for an ultrasound to scan the ovaries to determine how many eggs are present with stimulation. Generally speaking, we like to get somewhere between 2 to 4 eggs to stimulate in a cycle where in vitro fertilization is not being used. So this is an ultrasound that kind of shows a image of the ovary and the follicles forming within the ovary with stimulation. Typically, like I mentioned before, we like somewhere between 2 to 4. And each one of these follicles will contain an egg. And once ovulation occurs, these eggs will then be released to travel down the fallopian tube. A trigger medication can be used. The patient's body will naturally start and incite an ovulation to occur. Typically, when infertility specialists are stimulating the eggs, they would like to trigger or use the HCG hormone to help to start the ovulation so that it is on a scheduled time as opposed to randomly by the patient's body. The HCG trigger is injected by the patient, usually typically at a certain time, and then 36 to 48 hours after that HCG trigger has been administered, the patient will either have timed intercourse at home or intrauterine insemination can be considered. So what is intrauterine insemination? Intrauterine insemination is when we take the male sperm, we wash it and prep it for injection within the uterus directly using a small catheter that's guided through the cervix and into the uterus. The idea here is that we're increasing the sperm count inside the uterus as well as the egg count outside the uterus, and so in hopes of increasing the patient's ability to conceive. General time frame, usually we typically counsel that 1 to 3 cycles are recommended, with a roughly 50 to 60% chance of conceiving after 3 cycles of attempting. When individuals are unable to conceive in the first 3 cycles, if they were to consider additional cycles, usually an additional 10% greater success rate is seen using this option. And the general price of this option in the United States is somewhere between $200 to $1,500, depending upon what actual medications and treatment plan has been created. So I'll leave the questions here for the end of the lecture and give it back to Dilshad.
Thank you so much for sharing such a valuable and very informative knowledge with us. So now I'm again insert a third poll here. So it's going to be my last poll. So I'll give you a moment to click on your responses. So the question is that what are the different types of fertility treatments? So it's the multiple choices. So you have options: medicine, surgical procedures, and assisted conception. So the responses are coming now. Thank you everyone for participating in our poll questions. Okay, now I'm going to share the result with you. You can see on your screen the results. So we have like 20% are agreed with the medicines, and 10% are saying they're surgical procedures, and we have 10% are saying assisted conception, and 80% are saying that all of the above was the correct answer. So thank you so much for sharing your responses with us. So now we will move on to our speaker's final part of the presentation on fertility options other than in vitro fertilization. So Dr. Toral, it's your turn, please.
Okay, so I went over the non-IVF options. So now I'm going to review over the IVF options that are available. So it's actually just flipped. The 2 lectures are flipped a bit. Infertility, considering IVF options. Let's discuss that a little bit further. The general concept with IVF is that a woman takes drugs, largely injectables, for roughly about somewhere between 10 to 12 days. The doctor will then surgically retrieve those eggs with a long needle through the vaginal approach. And then those eggs will then be fertilized with sperm in a lab. The embryos then subsequently grow, and then the embryos can be genetically tested, and then transfer of the embryo occurs based on the genetic testing or non-genetic testing. Again, in IVF, ovulation induction is used this time instead of creating the roughly 2 to 4 eggs that we expect with using oral medications or a small dose of injectables. We use large doses of injectable medications to create as many eggs as we can potentially gather. Usually we try not to overstimulate patients or create more than 20 to 25 eggs. Injectable medications are injected, like I said, around 10 to 12 days, and then serial ultrasounds are performed to monitor egg development. So you can see the ovary here. Clearly, there's not 2 to 4 eggs. There's roughly somewhere between 8 to 10 eggs here on this image, and we would expect the other ovary to look similarly. Talking about egg retrieval, you can see the uterus here. The probe, the ultrasound probe is placed vaginally so that we can image the actual ovary when performing the retrieval. A long, slender needle that's roughly 17 to 18 centimeters is inserted into the vaginal introitus along the ultrasound probe, and then that needle pokes into the ovary, the follicles that we had seen previously on the ultrasound image, and the follicular fluid is then aspirated and those eggs are then retrieved. Once the eggs have been retrieved, they're seen underneath a microscope, and a small needle is used to perform ICSI. ICSI is intracytoplasmic sperm injection, which is where a single sperm is actually injected into the egg under the microscope guidance to help assist with fertilization. The embryos are then given the chance to grow, and so you can see that a day 1 embryo is just the 2 cells coming together to exchange genetic material and combine, and then those cells later split and continue to split to then create an embryo that's a day 5 embryo, or otherwise known as a blastocyst. Blastocysts on day 5 or further are then biopsied, and so here is an image of an embryo that's a blastocyst that's being biopsied. It's always biopsied on what would become the future placenta, and so then that biopsy is sent off, and genetic testing of the embryo is then performed to determine whether or not the embryo is normal in nature prior to transferring it back to the patient. Genetic testing helps individuals to determine whether or not the embryo is a boy or a girl. It additionally helps to know whether or not the embryo is normal in its DNA content, and likely going to result in a normal pregnancy. We can also test for known mutations that an individual or family members of the individual may carry, and so this is a way that we can prevent disease processes from being transmitted from generation to generation. The embryo is then transferred, and you can see here on the ultrasound that the bladder is full, the uterus is there, and a catheter is then guided through the cervix into the uterus, and the embryo is transferred in a small amount of fluid, and that fluid can be seen as a bright hypoechoic spot inside the uterus where it's being transferred. Obviously, the embryo is microscopic, and so that does not actually represent the embryo itself, but yet the fluid that the embryo is transferred in. General time frame and cost of IVF, it takes roughly about 2 weeks to stimulate the eggs, 5 to 7 days for the embryos to then form, and roughly 2 to 3 weeks for the uterine preparation and time for transfer. Cost, of course, is a lot more than your traditional non-IVF options. Cost includes the cost of medications, that cost of actually retrieval and embryo transfer, and then subsequently, if genetic testing is desired, the cost of that genetic testing to be done. And I'll again take questions here.
Okay. Thank you, Dr. Toral, for sharing your presentation with us. We will now open the floor for all your questions. Please remember to ask all of your questions using the Q&A button and refer your questions to both panelists and attendees so that everyone can view. Any questions we do not get time to answer will be followed up on our social media platforms. So we have pretty great opportunity to have an expert with us here. So let me pick your questions and ask the doctor and she will address your questions. So I have a question here. Someone is saying that what are the chances of successful IVF for patients with diabetes?
Diabetes is actually with a good prognosis when it comes to IVF. Diabetes does not typically affect the ability to get pregnant. However, it can create an inflammatory environment which can affect egg quality as well as the transfer of an embryo in its ability to actually implant. So it's really important to make sure that the diabetes is well controlled prior to going undergoing any sort of medical treatment or for infertility, and that you speak with your primary care physician regarding your medications to make sure that they are medications that are safe in pregnancy.
Okay, thank you so much. And still the questions are coming. So we have another question here. Let me read the question for you. Someone is saying that does a person with epilepsy can take the COVID vaccine?
That is a specific question that would probably need to be discussed with their neurologist. There are many forms of epilepsy that exist. As of right now, the COVID vaccine is considered to be a very safe vaccine, and many complications from the vaccine haven't been noted. But that being said, its use in epileptic patients, I'm not too familiar with and not quite my area of expertise.
Okay, thank you so much. We have another question, and someone is asking that what are the causes of infertility in a woman, like main causes? Though you have mentioned most of them, so can you just elaborate this question for them, please?
The most common cause of infertility is largely age related. So individuals who are greater than the age of 35 will find it more difficult to conceive than those who are younger. Following that, typically it's a hormonal issue here in the United States. It's very location dependent, diet dependent, and in the United States, it's obesity and hormonal regulations, polycystic ovarian syndrome that can occur that make it difficult for the patients to conceive as they're not ovulating regularly.
Okay, thank you so much. So someone is concerning about their egg development. So she's saying that she's 33 years old, 9 years of married life, and she is having one daughter, 5 years old, and now she has a clot in her head, and also she has that the doctor said that her egg size is not developing. So they give me some injection, but in vain. Like after 4 or 5 months of that injection, completely left that medication. Then I came to know I am pregnant. So I want to know, conceive, what should I do? So she's talking about.
It's probably important for her to touch base and receive care with an OBGYN to establish care for her now new pregnancy. I'm not quite sure what medication she was using as the injectable, but I am happy that she's pregnant, so congratulations for that. And in terms of COVID vaccination, my personal recommendation for patients is to receive the vaccine outside of their first trimester. So once they've they're greater than about 12 weeks, then COVID vaccination is recommended.
Yeah, thank you. Though we value all your questions, so we always welcome your questions. So I have again another question is about, does a pregnant require to take COVID-19 vaccine? So only the doctor can talk on it.
There's no requirement for anyone to take the COVID-19 vaccination at this time. Even school-age children, old individuals who are at increased risk for having the COVID virus transmitted, these individuals are not required. It is recommended at this time, but requirements are probably something that will take a while before they set in place.
Right, thank you. Okay, there is another question that, can stress really prevent you getting pregnant?
So stress can have its effect on infertility. Stress causes levels of cortisol to go up, and cortisol is inhibitory on the HPA axis, which is how you ovulate every month. So individuals who have high levels of cortisol may notice that their cycles actually depend on their level of stress that they may have. And so they may be able to have longer cycles or shorter cycles depending on their stress level. Its actual direct impact on infertility is not quite known, but stress reduction is recommended when undergoing any sort of infertility care. And so things like acupuncture, acupressure, as well as meditation and these stress reducing methods are recommended to patients by most infertility specialists.
Right, thank you. Okay, one more question, that is, can we eat prenatal vitamins with folic acid all together? So someone is wondering for that.
I'm sorry, I didn't understand.
Someone is wondering that they want to eat all the prenatal vitamins and the folic acid all together. So they're asking about that, can we take them together or should we separate them?
Yeah, they can be taken together. In the United States, prenatal vitamins are often created with folic acid already in them. So the two are already combined.
Oh, okay, thank you so much. Okay, someone is wondering that if endometriosis can affect fertility and just how hard it is for with that condition to get pregnant.
So that depends on the degree of endometriosis. Endometriosis can cause infertility. It's one of the reasons why patients with endometriosis may need to undergo IVF in order to conceive. Endometriosis causes cyst formations on the ovaries typically and within the abdomen. And so the endometriotic lesions can actually prevent appropriate egg production and cause issues with conceiving.
Okay, so let's go to another question, that someone is wondering if someone like she is in a regular basis of period and everything is going well, but she has like 6 years of married life. She is almost 37 years old, but she's trying to get pregnant and she never seen a doctor. So how you gonna, and what you gonna recommend for her?
So I would recommend that she at least touch base with a infertility specialist to get just baseline lab work to see what her hormone levels are at, and an ultrasound to ensure that there's no structural reason for not conceiving. Outside of that, if she's having regular menstrual cycles, it means that she's most likely ovulating. If it's possible for her to get ovulation predictor kits from a local drugstore or online, then she can try to see if she can locate the time in her cycles when she's ovulating to help improve her chances of conceiving.
Okay, thank you. One more question is, do you recommend breastfeeding moms to take COVID-19 vaccine?
I do. Having personally recently been pregnant myself and having had the vaccine, I do recommend that both pregnant women and breastfeeding women receive the vaccine.
Okay.
It's the only way that the unborn child or newborn will be able to get the antibodies, as right now the recommendations for administration of the vaccine in children are not there, as studies are still being done.
Okay, so Questions are keep coming. So let me ask one more question.
Sure.
Any lifestyle change that has to be made before IVF? Someone is asking for
It's
that.
really important to ensure that you're having at least 30 minutes of exercise 3 to 4 times a week. And I usually tell my patients to adopt a very high protein, high fat diet with low carb intake. And the fat content should be good fats, not, fried fats. We're talking about things like avocado, nuts, and high good fat containing food items that will help to limit the amount of inflammation caused by sugars.
Okay. Thank you so much, doctor, for sharing, but still the questions are coming. So we will look at that questions in our social platforms. So again, thank you everyone for taking time out of your busy days to join us in today's webinar. I hope you have learned many new things. I request you all to stay connected with us on our social media platforms for updates on our upcoming webinars. You can do this by liking and following us on Facebook, Instagram, Twitter, and our YouTube channel, and also on Rupani Foundation website. I would also like to thank our panelists, Mr. Chairman Nasruddin Rupani and CEO Mr. Amit Mathwani for joining us today, and our honored guest speaker, Dr. Toral Parikh, for giving her valuable time and sharing her expertise with us. Also, I want to take the time to thank all our participants for joining us in today's webinar. Our webinar would not be possible without an audience to engage with and learn from what our experts have to offer. Last but not least, I want to personally thank the Ivf USA team for their collaborative teamwork, especially Mr. Dominic Farino for his continuous support to make the webinars successful. Rupani Foundation USA highly appreciates your feedback, and we are always looking for ways to improve our webinars. Please take a few seconds to fill out the survey at the conclusion of our webinar and let us know if you have any suggestions for our upcoming webinars. Thank you, everyone. Have a great rest of your day. Thank you, doctor.
Thank you.